In the last video, we looked at the first section, we looked at key area 5, subsection A and B part 1 of the Unit 2 course. Today, we're going to look at vasodilation and vasoconstriction. A lot has been removed from the course, so there's very little you actually need to know, just the very basics of vasoconstriction and vasodilation. So, a little starter, what causes a red face? So a red face, as you may know from National 5, is caused by the blood vessels in your body dilating to allow blood to go to the surface of the skin. Another starter question we may ask from the previous video is, what is the difference between an artery and a vein, and how are capillaries different to both arteries and veins? The answer to that question would be arteries have a much thicker wall of muscle inside the blood vessel, which means that veins, because of space requirements, have a larger lumen relative to their size. Veins also contain valves which prevent the backflow of blood. Capillaries are different to arteries and veins. They do not contain valves, similarly to arteries, but they also don't have these outer layers of elastic tissues and these smooth muscles. So they are just one cell thick, and that allows the diffusion of things in and out of the capillary. So, nice and quick. Vasodilation, vaso meaning the blood vessels, and dilation meaning relaxation. So blood can be diverted towards what are called peripheral vessels. So we think about the main vessels in our body. You think about your aorta leaving the heart. You think about your vena cava coming to the heart. You think about your mesenteric arteries sending blood to your guts for digestive reasons. You think about your hepatic portal vein taking the blood from your organs back to other organs. These are very important kind of proper vessels. You then have all the little peripheral arteries and veins that are out on the outskirts of your body. So the tiny little arterioles that send blood out to your fingertips and the veins that bring it back. So blood can be diverted towards these little shunt vessels on the outskirts of your body, or it can be taken away from those vessels. So the smooth muscles we talked about in arteries can contract or they can relax, and that limits or increases the amount of blood that can go to the peripheral parts of your body. In vasodilation, these smooth muscles relax, and that allows more blood to go to these peripheral vessels. So they're wider, so more blood can get there. This means that if you are quite warm and your body wants to lose heat, you can become flushed, so you can vasodilate. The blood will go to the surface of your skin, and just because of its nearness to maybe a colder air, or you might have sweated, the heat from your blood will evaporate into the atmosphere. So in that way, your body can lose some of its intrinsic heat. The opposite can happen, so these shunt vessels can vasoconstrict, and they can vasoconstrict to reduce blood flow to the skin. So to make you, at the moment, you're probably not incredibly flushed, so you're probably mildly vasoconstricted to prevent all of your blood going to the surface of your skin. But it can go further. If it's very, very cold, or you get a massive surge of some hormones or shock, the blood can be diverted away from the outskirts of your skin. So these vessels can completely vasoconstrict. So the blood is diverted away from the periphery of your body. The smooth muscles in the arteries will contract, preventing the blood getting through, and so you will appear pale. So a normal cross-section, you can see vasoconstriction. It's not completely cut off. In this case, it's mildly vasoconstricted. So less blood will go to the periphery, so you'll appear less flushed than normal. And vasodilation, the smooth muscle has relaxed as much as it physically can, and so as much blood as possible will go to the periphery of your body. Vasoconstriction, you can see they're kind of constricted off, so not a lot or no blood going to the periphery. And vasodilation, you can see much more blood is going closer to the outskirts of the body. It will heat up these tissues, and that heat will be lost to evaporation. So, have we go at completing the sections of your booklet relevant to this topic? So thinking about vasoconstriction, being when you're cold. Technically, because you have a limited amount of blood, you will also vasoconstrict when you've had a large meal, because that means that as much blood as possible can go to your gastrointestinal tract. So as the food is moving down your small intestine, your blood is sent to the villi and the blood vessels in your gut, and it means you can pull out as much food as possible, much nutrients as possible from the gut. Because you've got limited blood supply, that means you have to pull blood away from the other parts of the body. So you vasoconstrict. That's one of the reasons you shouldn't really go for a long run or try and do a lot of exertion after a big meal, because your body just won't send as much blood to your muscles as normal. Vasodilation, so during exercise, your body will try and send blood to your leg muscles, for example, or your arms, depending on what you're doing. And when you overheat, you will vasodilate. And during embarrassment, as a social cue, you will vasodilate. Okay, so that is the end of this topic. As I said, quite a small one. In the next session, we will look at pressure filtration and the lymphatic system. It's very simple. We just look at how the fluid gets out into your tissues, how diffusion happens between the cells of your tissues and the lymph, and how that tissue is then recycled back into the circulatory system. So hopefully you understood everything in today's lesson. Please do ask if you're stuck on anything.